The synovial joints. These joints are diarthroses. So they are freely movable. They are the most movable joints in your body. So we would say that they are diarthrotic, for example, another way to write it, diarthroses. And these are generally freely movable joints. Okay, when we talk about synovial joints, this is the most common joint in our body, and it's what we see in our limbs, our upper limb and our lower limb. We even have inner ear bones, the incus malleus and stapes, the middle ear bones, that have synovial joints between them. So they can be tiny. So if we look at the characteristics of these joints, one characteristic is that there is articular cartilage. This is not something that might be found, say, for example, in fibrous joints. There are, in some cases, in cartilaginous joints, there is some hyaline cartilage. But remember that this is the hyaline cartilage that protects the ends of bones. Remember, our skeleton starts off as a hyaline cartilage model, like our humerus. And then when it is ossified, that hyaline cartilage on the ends, it stays there, okay? So we have articular cartilage as a characteristic. We also have what is referred to as a joint cavity. This is not seen in cartilaginous or fibrous joints. So the joint cavity is a fluid-filled space that is unique to synovial joints. So this is my fluid-filled space. And the fluid is produced by the synovial membrane. You might have heard of warming up your joints before you exercise. And so that would be kind of warming up that synovial fluid so it is less viscous and more slippery. That might be a good thing to do before exercising. We also have what is called a joint capsule. This is sometimes also referred to as an articular capsule. And this is actually connective tissue that covers, it's like a fibrous layer of connective tissue that covers the joint. So fibrous, dense, irregular connective tissue. Covering the joint. And the inner part of this joint capsule is what makes up that synovial membrane that produces the synovial fluid. We also have reinforcing ligaments. So that would be a fourth characteristic, reinforcing ligaments. And this helps to determine your joint stability. You might have heard of people that are hypermobile. So they might have hypermobility, and contortionists that can move their body in weird shapes oftentimes have looser reinforcing ligaments. And this can actually be not necessarily a good thing. Sometimes when people are really, really flexible, it has to do with the fact that they have hypermobility. And hypermobility could mean that, for example, your hip joint might just actually pop out of its socket. That should not happen on a normal basis. But in some people that does. But that means that when they can do that, that means that they might have a lot more flexibility than other people because of that. So let's just look at a diagram that shows some of these. So this is a ligament right here. It is white because of the collagen fibers. This whole thing is my joint capsule here, right here on the inner layer. The most inner part of that joint capsule is the synovial membrane. The blue is the articular cartilage. The space here is the joint cavity, which contains that synovial fluid. And then you'll remember that there is around our bones a connective tissue, which is the periosteum, and this is what allows that to connect to the bone. So we have this connective tissue covering on the outside of our bones. Sometimes associated with these joints, these synovial joints, is we have these packets of synovial fluid, which are called bursa. So these are packets or bags, sometimes they call it sacks, right? Packets of synovial fluid. Okay, and what these do is they decrease friction. Between skeletal structures. So let's look at the shoulder joint. We have here the acromion that is sitting on top of that shoulder joint, and there is a subacromial bursa that sits underneath that. And so when we move the shoulder, that is what helps to keep the humerus from like actually rubbing on the acromion. We also see here, this is a tendon sheath. And the tendon sheath wraps around the tendons. And also this is a tendon of the muscle. And so it also kind of moves, right, within that groove. There's a groove that it moves in, and that helps to prevent that friction. Now, when those get inflamed, you can have what is called bursitis. So anytime you have inflammation in a structure, it is called itis. So bursitis is inflammation of the bursa. And sometimes that can actually be very painful. And sometimes it can actually cause an enlargement. Most notably in the knee, sometimes people get these enlarged bursa, and it looks like there's this huge lump on their knee, and that is due to bursitis. And so those would be the structures that are associated with synovial joints. And obviously the shoulder, being very diarthrotic, very movable, is an example of a synovial joint.